Welcome back, folks. We are now joined by Kirk Prichard, who is Vice President of Programs at Concern Worldwide U.S. Kirk, thank you so much for joining us.
Thanks for having me.
Just describe the organization's mission and how that mission has become even more important and has evolved since the advent of COVID-19.
Yeah, so Concern Worldwide is an international humanitarian aid organization. We've been around for about 50 years. We were founded out of Dublin, Ireland, in response to the famine in Biafra. And we really just go to some of the hardest hit countries in the world to provide humanitarian assistance and development assistance. So that's everything from responding to an earthquake or a hurricane, or some longer term agricultural work, providing safe water, shelter, etc. And COVID's really been a kind of triple whammy to us here at Concern and the humanitarian community in general. You have COVID itself, which is affecting some of the countries we're in, especially in South Asia. You'll see some huge numbers that are starting to spike out of India, Bangladesh, Pakistan. But then on top of that, you also have its effect on our ongoing programming. So if Concern, for example, is responsible for providing millions of people with their daily food rations, so their food that they rely on for a daily basis. And when you have borders being shut down, flights being rerouted, quarantines, et cetera, it just makes that programming itself so much more difficult to accomplish. And then the triple part of that is that on top of that, we're seeing a huge slowdown in the economic growth worldwide, which dramatically affects the people that we work on with, most of whom survive on less than $2 a day. So any interruption in their ability to earn a livelihood is life-threatening and devastating.
Kirk, put this in perspective for us. There are many people in our country, there are certain people in very high offices in our country who largely believe that it's not just America first, but America pretty much exclusively. We have to protect ourselves in the world. There was a lot of that talk early on in this pandemic. A significant portion of the world is now trying to protect themselves from us. Should we be protecting ourselves from each other, A, and B, how the heck do we deal with this globally when we are often so provincial in our thinking?
Yeah, well, I don't think it's really an either or. And I think we can do both. We can walk and chew gum at the same time. And I think, if anything, COVID and some of these other illnesses that we've seen, such as Ebola, has taught us is that in the interconnected world that we live in, it's just not possible to say this is only an American problem, or this is only an African problem, or this is only an Asian problem. These are global problems that need global solutions. And if we don't address these things globally, both in the health realm, in the economic realm, in the development realm, it will come back to the U.S. if you want to think of it in that terms. So that's why I think that we can solve the problems here in the U.S. We can work on the response here while still providing leadership and support overseas.
So let me put this out there. Global pandemic, global response. Interesting. There are some who question why we can't just have a federal response in the United States of America, as opposed to each state, each county, each municipality. Now we're talking globally. So when President Trump refers to COVID-19, you know, it has many names, not my description, but his, including the China flu, not a flu. And I'm not even going to use some of the language that he has used that is incredibly derogatory and disrespectful to people of Asian descent. Question: does that bring us closer together, or just bifurcate us even more?
Yeah, I think you're probably answering your own question there, Steve.
Yeah, I'm sorry, that wasn't even a question. You're right, that wasn't a question.
You're totally fine. But I would say that within the U.S. government, there are lots of good people that are still doing lots of good work, especially in response to COVID and the international response itself. We have excellent partners in the U.S. government in what was formerly known as the Office of Foreign Disaster Assistance, now the Bureau of Humanitarian Assistance, providing millions of dollars and helping hundreds and hundreds of thousands of people out there, and really advocating for that global response. So I think that we still do have a good government response to this that is helping us out, and hopefully will continue to provide that support.
But the World Health Organization, easy to criticize, as legitimate criticism of them. But if in fact the United States begins to pull away more and more from the World Health Organization in the midst of this global pandemic, what are the implications, Kirk, for not just the work that you and your colleagues are doing, but more importantly, frankly, for the people around the world that you are trying to assist?
Yeah, and with the World Health Organization, it's bigger than just COVID. So for example, I don't think we would actually be pulling out of the World Health Organization for at least a year or two. based on that declaration. Hopefully by that time, COVID will be more under control. What we worry about is things like vaccination campaigns, so like polio and some of these other vaccines that are going around there. The World Health Organization plays a huge role in that. And we're already seeing some of these numbers start to spike. We're starting to worry about global health trends, mortality, morbidity. There's just, put simply, there's going to be hundreds of thousands of children, young adults, et cetera, that are in much worse health shape as a result of this because they can't have access to antibiotics, because they don't have access to anti-malarial pills, that they don't have that polio vaccine, that they don't have tuberculosis treatment. So I would argue that even more important for the World Health Organization from the coronavirus side is that they're allowed to continue their ongoing work, the good work that they do around things like polio, like tuberculosis, like malaria, et cetera.
Now, you're coming to us from Jersey City. I'm in Montclair. You're a Jersey guy, as am I.
Fourth generation.
Yeah, I appreciate that. And we can be awfully provincial, however. You know, because you live it every day, that it is not only impossible, but it's actually not smart to be this provincial. If someone were watching right now on public broadcasting or seeing us on other platforms and they said, I appreciate what this guy Kirk is saying. I respect the work that Concern Worldwide is doing, but you know what? We just have to protect ourselves. So here's the question. What message do you have for them to help them understand that what is going on in the rest of the world and having, quote, concern for the rest of the world is in our self-interest, whether in Jersey City, Montclair, Newark, Brooklyn and New York, Bronx, wherever?
That's a good question. And I think it goes down to kind of, again, two parts. One is that
Sure.
I would argue we have a bigger moral imperative, to help those that are less fortunate than ourselves, both domestically and internationally. But to your point, if we just want to look at this in our own self-interest, there's been many, many quotes and studies out there about the importance foreign assistance, and especially things around pandemics, do for our own good. When you have an unstable world, when there's rife economic disparities, when there's terrorism thriving, when governments are failing, when all these things are happening, it makes the U.S. less safe. I mean, if you wanted to look at things like terrorism in the Horn of Africa, this can come back to the U.S. All these things. There was a former Joint Chief of Staff General who said, we need foreign assistance because then I can buy less bullets. It's very simple. It's a lot cheaper to provide. I mean, foreign assistance is a pittance of our total budget. It's less. It's like 1% or less. It's so small, and the return on investment on that. And that's from the security standpoint. We're not even talking about the economic standpoint. So many of the former countries that we used to provide humanitarian assistance to are some of our biggest trade partners now. So we're creating markets. We're helping these things out. And if you want to get really into kind of some of the geopolitical aspects of it, China's stepping in as well. You go to Africa, lots of these countries, you go to a lot of these countries, the number one nationality there are the Chinese, nationalists building roads, putting in these infrastructure projects, et cetera, et cetera. So, I mean, I like to make the kind of moral argument, that we should be helping out those people that we can. We're a country like that. We've been founded on that. We've been founded on compassion and empathy, hopefully. But then it's beyond that. There is definitely a national security interest, and there's a geopolitical aspect to it as well.
Kirk Prichard is Vice President of Programs at Concern Worldwide U.S. Kirk, I want to thank you so much for joining us. Best to you, your family, and to the folks at Concern and the work you're doing every day. Thank you.
Thank you, Steve.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, PSC&G, Hackensack Meridian Health, the New Jersey Education Association, Gibbons PC, New Jersey Institute of Technology, NJM Insurance Group, the Fidelco Group, and by Wells Fargo. Promotional support provided by the New Jersey Business and Industry Association and by ROINJ.
Day after day, we rely on electricity for all the ordinary things in our lives and for the extraordinary.
Mom! Hey, sweetie. How are you? So, tell me about the game.
I scored 2 goals.
That's my boy.
At PSEG, our commitment to you now is more powerful than ever.